Welcome to the second week of the class. In this week, we're going to go over a number of common disabilities in worker compensation and long-term disability and personal injury cases. These being low back pain, amputations, carpal tunnel, burns, pneumoconiosis or breathing disorders, knee injuries, head injuries. These are the common types of disabilities. And one of the themes that runs through all of these areas is pain and how pain affects people. And I'm going to be focusing on that a little in this lecture. I'm not going to be focusing on the specific disabilities. I believe that there are readings for you in that regard. We also have some other information for you to look at in terms of different states and how those different states administer rehabilitation in the private sector, as well as benefits and the levels of benefits that are provided. And again, the purpose of this is to have you become familiar with and see the differences that can occur. We also have a case study for you, the case of John Q., who is not very long, just one paragraph for you to read, and then there are some questions, 7 questions for you to answer relating to John Q., who has a knee injury. So that's what we're going to be doing this week, and I certainly want you to refer back to materials from the first week in terms of the issues that we have here in this second week. As I said, one of the primary activities that you will run across in dealing with private sector rehabilitation is the notion of pain, and pain is something which is difficult to measure. Pain is something that different people have different tolerances for and thresholds for, and pain is something that although physicians can say that the nature of the person's injury and the nature of the impairment would lead to pain or would not lead to pain, the severity of the pain is something that is experienced individually. And as I said, each individual has a different pain tolerance. I think that it's important to try to recognize this and to try to see what are the factors that influence pain. And I think some of the factors that influence pain would be if somebody has a job to go back to and they feel that they can do the job, then the subjective sensation and feeling of pain will diminish. That's been my experience. And people will find ways to minimize the impact of the pain that they're experiencing. If someone doesn't have a job to go back to, if the person feels that he or she cannot go back to that job, and the person doesn't know what else might be out there for the individual, then the person may report a severity of pain that is greater than they might actually have. So pain is a subjective notion, and it's very difficult to get a handle on. And pain is something that when we talk to somebody, it's important to find out how the person is experiencing the pain that they report and what their activities are. Now, we are not physicians, and so as rehabilitation professionals, we're limited in terms of what we can do or not do with regard to a person who reports having pain. But I think when we look at the physical restrictions that a doctor may present, we might say to a person, well, your doctor says you can do these activities, and ask the person about whether he or she feels that they can do those activities. Then get some sense as to whether, and then go back to the physician to get some sense as to whether indeed this person can work within those tolerances, those restrictions that the doctor gave, and ask the doctor about the pain that the person is reporting, and see what the doctor has to say about what the person is saying about the pain. Now, obviously, we cannot contact the physician without first getting the permission and approval of the individual, and we have release forms to allow us to do that. But it's important that we try to make some sort of assessment as to the pain that the person has and how it affects that person, and also the degree to which it interferes with that person. And one of the questions that is very difficult to answer in this equation when we deal with pain is why we would see some physicians saying that basically this person has no limitations, can do anything they want to do, yet you'll see the person, when you talk with the individual, say, I can't do anything. Say, the pain is so severe that it prevents me from being able to engage in any type of work activity. And these are questions for us to deal with, and these are very difficult questions for us to deal with. With regard to rehabilitation, when you have someone with pain, I think there are certain treatment modalities, and we would need to work with the physician closely who is administering or prescribing medication to make sure that the medication that's given is appropriate for the person, and if we are recommending a certain type of job that the person can return to, that we talk with the physician about whether this person can do this job, not just based on the restrictions that are given by the physician, but also based upon the medication to make sure that there aren't any contraindications such as not operating equipment or drowsiness that can occur or other factors, that side effects from medication. So we would need to work closely with the physician in terms of medications. I think also another way that we need to work closely with healthcare providers, whether they're physicians or occupational or physical therapists, would be to look at whether the individual whether the individual is going for treatment appropriately. If the individual is being treated, for example, in terms of physical therapy, are they going for the physical therapy treatments as prescribed? That's an important factor to make sure that the person is actually cooperating and participating, to make sure they get the full benefits from treatment. My view of rehabilitation, and I try to be optimistic about it, but my view is that if we can show the consumer that he or she can do things, if we can show the consumer that either at the present time or through some sort of rehabilitative program or retraining program or job placement program, that they can go back to work, they can function on a job within the parameters of whatever limitations or pain that they're having, then I believe that we can help the person to deal with and mitigate the pain. Another factor that I think also impacts the pain issue is what happens when you have a person who has been working, has been earning $15 an hour, let's say, but can't do that job anymore. And all they can do right now would be a job that would pay at a much lower rate, a job that would pay $7 or $8 an hour. We're dealing with a person's self-esteem. And so they may say, well, why should I take a $7 an hour job when I was earning $15 an hour? Well, that's not really worker compensation's problem as such, but that does come into the equation, and people feel that that their payments and the money they can earn does impact their willingness to go back to work. And sometimes, as I said, people will say, they'll use pain and say, I'm in too much pain to do work activities. Can we go, Brad? So we deal with self-esteem issues, such as someone saying, and to me it makes sense, someone saying that, well, I was earning $15 an hour or $20 an hour, whatever it is, I can't do that job, and why should I do a $7 or $8 an hour job? And that deals with a person's pride and self-esteem and self-concept. So those are issues that we deal with. And a lot of times what you'll see in referrals in private sector rehabilitation is we're not going to get the referral of the person who gets injured and then goes back to work, because they don't need us. We're going to get the referral of the person who gets injured and they can't do what they were doing before, or they need help in having the job modified. We're going to get the difficult case, not the easy case. And so we get these issues where someone can't do what they were doing before, but they can do other things. And you're dealing with self-esteem issues. We're also, when you work in private sector rehabilitation, what you'll also see to a great extent is that the more education somebody has, the more marketable job skills the person has, and the less physically demanding work the person was doing, the easier it is for a person to go back to work. So if you get somebody who maybe didn't graduate from high school, you get somebody who's done manual labor, who's done, made a lot of money, relatively speaking, doing manual labor, operating equipment or working in the factory, but can no longer do this type of work anymore, and they can only do some sort of entry-level minimum wage type of job. That's all that's left to them. They don't have the options that people who have education and job skills would have open to them. So these become issues that we deal with. And then, unlike many of us as professionals, we're always in the mindset of being retrained in more education and continuing education. Well, if you have somebody who's worked in a factory for 25 years, and that person can't do whatever factory work they were doing, and they haven't been in school in a long time, they don't have a mindset to go back to school to benefit from education. So we're really dealing in a difficult area, and in many cases such individuals want the worker compensation program to pay them more than the worker compensation program is set up to pay them. And so you get into these binds with people and situations with people that make it difficult to try to help somebody become to participate and become rehabilitated. And that's why I think a lot of times people will describe the severity of pain that they describe when what they're really describing would be not that they don't have pain, and I'm not saying people don't have pain, but what they're also describing are other factors that come into play, such as the inability to do the work they were doing before, not having significant or sufficient education to do other work, and also factors such as of not having job skills. And you also get situations, like I said, things that we don't know about. If someone's been working for an employer for 20 years, then they may, they may feel that, that they've given their work life to this employer, and they may feel that the employer should be more obligated to them to modify a job. On the other hand, the employer may feel that this person wasn't the best employee around, and and this is a chance, not they're injured, to get rid of them. And these are things that we may not always hear about, but yet these may be undercurrents that are occurring in the situation when we're working with individuals who've had some type of work injury or some type of disability. So these are factors that come into play. Unfortunately, from our point of view, in many cases, that the person who has retained us doesn't want us to delve into these issues. They just want us to deal with here's the person, here's the restrictions, here's what they did before, here's what they can do now, now go back and place them. They don't want us to get involved in terms of dealing with these interpersonal issues and dealing with even family issues. Because I haven't mentioned family issues yet, but you might find that just as in public rehabilitation, whether somebody is successful or not at going back to work, in large measure, it depends on the support system the person has. And you might find that, and one of the things that I have found over the years is that initially when somebody gets injured, they look at wanting to go back to work and getting rehabilitated. And the support system, they may have significant others, may be saying, well, you can't do this work and you don't want to get injured anymore. And pretty soon you have the individual evolving from saying, I want to go back to work and trying to go back to work perhaps to internalizing what the support system may be saying about the inability of that person to go back to work. So you have these factors which also, and these dynamics which also come into play. And unfortunately, the people who hire us in private sector rehabilitation will frown on us getting too involved in doing counseling with significant others. And that's like tying your hands behind your back and trying to do the job. It becomes somewhat more problematic and more difficult. Another factor that comes into play in terms of the injury and in terms of pain that the person may have will be factors such as this whole litigation process that I mentioned. Because people don't get whatever monetary settlements they get until they get to maximum medical improvement, that person may have had the potential to return back to work, but because of the length of time it may take and delays that may occur in getting to maximum medical improvement, for example, they may delay that until the person's had surgery, or they may delay that until they've had therapies. The longer someone's off work, the more difficult it is to get back to work. The person may also be applying for Social Security disability, and they may not want to show that they can go back to work because they may feel that would ruin that case. So there can be a lot of things that that come into play here that are dynamics that we would need to deal with, and can influence, in my judgment, how much pain the person reports having and the severity of that pain. And again, it's not that I'm belittling pain or trying to minimize it or say it doesn't exist. I'm just saying that the reported pain may not be as significant or severe as the person says because of all these other factors that are difficult to quantify, and because pain is so subjective, we really don't know how much the person really has. So I believe that you do have information about disabilities to look at, common disabilities, and information about those. You do have some exercises to do in this section. And in the third week, we're going to be talking more about these case management issues and more about these interpersonal issues that I've mentioned. Again, if you have any questions, feel free to send us emails, and we'll be glad to clarify any points that you might have.